Your genes hold the answers to your family's overall health. I'm Dr. Paula Krupstad, and on the Get to the Root with Hope for Healing podcast, I sit down with experts in genetics, functional medicine, and family care to explore what's really going on beneath the surface so you can stop guessing and start healing. From personalized insights to practical tools, we bring you whole family wellness that starts at the root. Welcome to the Get to the Root podcast. I'm your host, Dr. Paula Krupstad, and today I'm joined by Dr. Julia Ward. She is the host of the Functional Edge podcast, and I'm so grateful to have you here today. Welcome, Julia.
Thank you so much. I'm so grateful to be here.
Yeah. So I just wanted to ask you a few questions. And I remember the first time I spoke with you because I asked, how did you get interested in functional medicine? And you said you wanted to avoid menopause.
Yes.
And I love that answer. I've never heard that answer before. The thing that's really unique to you is that you are in the Sugar Land area, the Southeastern area, and you perform hyperbaric oxygen therapy. And we have a huge population of children with autism and neurodevelopmental challenges. And so let's take a step back. You received your medical degree from the University of Southern California,
Yes.
and you served in the United States Navy, practicing as general, urgent, and emergency medicine. You're also, it looks like, the mom of 5 children,
Yes.
too. I
Yep.
love that also. And then you have founded your own practice. And what's the name of your practice?
It's balanced body functional medicine.
All right. And where's the website that we can find you at?
It's drjuliaward.com.
All
So
right.
drjuliaward.com.
Fantastic. All right. So fill me in on kind of your journey moving into functional medicine. And then I am going to ask you all kinds of questions about hyperbaric oxygen
Great.
because that's the advantage of doing these podcasts. I get to learn along the way.
Yeah.
Yeah,
Awesome.
let's get going.
Awesome. Well, so I was doing, my career was a little bit unusual because of the Navy and they split up internship and residency and things like that. And I was doing primary care basically. And I had gotten into aesthetics, the Botox, the fillers and all that kind of stuff. And about that time I started feeling really run down, really tired. I wasn't having any hot flashes or night sweats, but I could tell like there was something that was changing, right? And I just felt like I was exhausted. Now, I had reason to be exhausted, I mean, I had 5 kids, I'm working full time, all that kind of stuff, but I felt like it was beyond that. And when I went to my GYN doctor, I really didn't get much answers that were satisfactory. So I started looking into bioidentical hormones, and that's how I found functional medicine. So for me, it was more of like my hormonal changes brought about a lot more chronic fatigue than anything else.
Got it. Got it.
Yeah.
Now, as far as hyperbaric oxygen goes, did you have exposure, oxygen therapy? Did you have exposure to that in the Navy?
No, not at all. Yeah.
Wow.
Yeah.
So what drew you to that, and what kind of training have you had with that?
Yeah. So I was doing an online course by Dr. Daniel Amen. I don't know if you're familiar with him.
Yes.
Yeah,
Yes,
I
very much
love his
so.
approach to visualizing the brain. And so I'm doing this course of his, and he was talking about hyperbaric oxygen and how beneficial it could be to healing the brain. And I just started thinking, well, I wonder how difficult it would be to get hyperbaric oxygen in my office. And then soon after, I came across an email from the International Hyperbaric Association. I went to one of their conferences and learned all about hyperbarics. And that's how I kind of got started on the hyperbaric journey because it was so appealing to me because here's a treatment that is been around for about 100 years. It is 100% natural and it fixes so many things. You go in for one thing, maybe it's to decrease inflammation or to heal a head trauma or whatever, but you also get the other benefits that comes along with it. Whether that's normalizing the gut microbiome or stimulating stem cells, or there's just so many wonderful things about the hyperbaric chamber.
So if you were speaking to, say, some parents of a child with autism, and you were explaining the basics of hyperbaric oxygen. Just treat me like I'm that mom and
Yeah.
explain it to me from A to Z kind of a
Okay.
thing.
So you go in this chamber. It looks like a mini submarine, but you can sit up completely. You can turn around. Our chambers are steel chambers, so they look like, metal kind of tubes, and there's little like portholes in there that you can see out. But you go in there, and ours are extra large, so we can actually fit 2 adults in there. And I've actually had a mom and 3 kids in at one time.
Wow.
But there's oxygen hookups for only for 2 people, and so 2 people in there can breathe a mask of 100% oxygen. Now, during this time, room air is creating an increased pressure inside, so pressure is increased all around you, and there's a constant flow of fresh room air that goes in and out of the chamber during the entire time, and so that increased pressure really super saturates all your tissues with oxygen, and so now because normally we rely on our red blood cells to pick up the oxygen from our lungs and deliver it to the tissues. But with the chamber, you're breathing in 100% oxygen and all that pressure is increased all around. So now it's super saturating all of your tissues. You're absorbing like 20 times the amount of oxygen than you normally
Oh,
do on just room air at regular pressure. So,
fantastic.
when we're not in a chamber, we're at 1 atmosphere of pressure. But we can dial up the pressure in those chambers to our chambers go up to 2.4 atmospheres of pressure. So you really get this dramatic increase in oxygen, and what the oxygen is doing, it's sort of the rate limiting step that the body needs for growth and repair. So it's like you're feeding all this oxygen to the mitochondria, which are like the batteries inside of our cell. And so now it's like they're revving up. They're like, okay, we're producing more ATP, more ATP. That does generate more reactive oxygen species. So it generates more free radicals in the beginning. But then your body compensates and it starts revving up your natural antioxidant defense mechanisms. And that sort of carries over. And so your body adjusts to this. And that's why hyperbarics is meant to be done in a series. It was never meant to be a one and done kind of a thing. You have to, like, there's a stacking effect, I say, it builds on itself. So
Mm.
you go in for ideally like 5 days a week for an hour to an hour and a half each. And then you take 2 days off and then you go again. And so this will stimulate more energy from the mitochondria, but it also stimulates the growth of more mitochondria. So it's like you're
Mm.
growing more batteries in your cells,
That's
as well as it's stimulating our immune system, but in a nice balanced way.
that's beautiful. How do you feel about soft chamber?
I mean, soft chambers have their place. They are wonderful for if you want to have one in your home, you can get that extra consistency. And so there's still a lot of benefit. The home chambers go to 1.3 atmosphere and
Okay.
generally are not being used with 100% oxygen. They're just on room air. Now, sometimes people will get an oxygen concentrator, which is a machine that will pull the oxygen from the air and concentrate it to like 97%.
Okay.
And so
Okay.
again, you get more, saturation of oxygen that way. And so you definitely get benefit from the home units. It's just you're getting exponentially more oxygen dissolved in the body using the hard chamber because it's going to a higher atmosphere.
I appreciate what you said about the mitochondria. Now, in your office, are you using regenerative medicine IV like extracellular vesicles, exosomes, and stem cells at all?
I am not. No.
Okay.
I kind of well, let me back up a little bit. I've used exosomes in when I do a procedure called the O shot.
Right.
I feel like that really boosts it and helps it along. But
Yeah.
I have not gotten into the well, first of all, actual stem cells are illegal here in the US. Exosomes are kind of in a gray area. And I think it's just because of this kind of legal
Yeah.
gray area that it just makes me a little nervous to delve into
Well,
that.
let me let's unpack that a little bit because actually the regs just changed. And
Okay.
yes, a couple of years ago, the FDA shut everything down because we were
Yeah.
using exosomes or extracellular vesicles. Because there were so many people bringing things to market and you didn't have a good chain of custody, and of course, we didn't wanna do harm than good, or it would do more harm than good potentially without knowing where they came from. So this is something because I'm thinking for some of our patients, there's a lab called Vitti Labs, VITTI Labs, and it
Mhm.
is FDA regulated and it's American Tissue Bank certified. And there's not too many companies that do that. Now, they have now the verbiage, it's human cellular tissues and products is what you have to say. You can't say exosomes, you have to say extracellular vesicles and
Okay.
products,
Yeah.
and cellular products. So we just restarted doing this and we're doing this IV. And I'm thinking, knowing that you said 2.4 atmospheres of oxygen, if someone could come in, we're doing this for autistic children. We just performed this IV for a little girl with type 1 diabetes a
Mm.
couple of weeks ago who's still in her honeymoon period. And so we gave 1 milliliter of extracellular vesicles IV,
Uh-huh.
followed by 1 milliliter of stem cells. These are ethically sourced C-section deliveries here in the United States, donated, screened for everything under the sun. So you might want to
Yeah.
hashtag Biddy
Mm.
Labs, take a little
Okay.
peek.
I will do that.
Yeah, so I'm thinking that some of these families, I would love to refer to you because this goes beyond what a soft chamber could do at 1.3 versus 2.4 atmospheres.
Yeah.
Wow. And then, maybe you could start, doing that again too, knowing that. So,
Yeah. Yeah.
um, yeah. Okay. So you answered my question. You said so twice a week in a series. Did you say about an hour and a half in the
Well,
chamber?
no, actually 5 days a week is ideal.
5 days a
Yeah, yeah,
week.
5 days a week,
Okay.
yeah, and I
Okay.
think that's why it makes it so critical where the hyperbaric is located, because nobody really wants to drive 2 hours to do an hour
Yeah.
treatment, and then, it's like that's your whole day, right? So, yeah, it helps when you have something that's close by.
Now, when you say a series, it's kind of like IV ozone. IV ozone is never a one and done. It's usually
Right.
meant to be in a series when you're dealing with like Lyme or
Yeah,
Bartonella. But how many, and I guess this is an open-ended question and I'll let you
yeah.
kind of fill in the gaps. How many treatments would you recommend, say, for a child with autism that's mildly affected by it?
So most of the research in hyperbarics focuses around 40 hours for whatever
40 hours.
reason. Yeah. So that's, kind of what we recommend of a lot of parents. And we do have several families that come here with autistic kids and they get
Uh-huh.
great results. But a lot of them then will start with like, let me just do a package of 10, and then they'll see results at a package of 10. And then they're like, okay, now we want to do some more. They generally go to 40. I've had, 60, 80. It just depends. Yeah.
Great. That's so exciting. So, when you talk about reactive oxygen species being released, what can people expect to feel initially and then to feel better? Let's say it's an adult that can articulate how they feel.
Yeah. So it kind of depends on what it is they start with. So if somebody doesn't have any issues, if they don't have any, thing that they're necessarily treating, the first time or two, they may not feel much of a difference. But if somebody has some like nerve pain or some sort of, issue that they are, or head trauma, I've treated professional boxers before and they can tell a difference like almost immediately. Like I feel better. Yeah. So it really kind of depends on where you're starting as far as what you feel. But yeah, and it doesn't take too long. I mean, generally within 4 or 5 sessions, you're definitely going to feel something.
All right. All right.
Yeah.
Now, you said you are treating some kids with autism. Can you recall some of the benefits and potentially where they are in their journey? I don't expect you to remember all of that, but
Yeah. Yeah.
the benefits that the parents tell you about. I'd like to thank Fagron Genomics for sponsoring our podcast. Without knowing what your precision genetics are, you don't have a roadmap. So please log on to our website, schedule a welcome call, and see what the wellness blueprint can do for you. That's the premier and proprietary genetic panel that Fagron has allowed us to create.
Yeah, the parents tell us that on in general, they are becoming more verbal. They're having better days in school. It's just a better day all around. And so they
Nice.
just make more progress. And it makes sense because autism is like it's a mitochondrial issue, right?
Yeah, yeah.
Yeah, it's similar to the neurodegenerative kind of diseases and the hyperbaric is great at repairing brain tissue and generating more energy. So, yeah.
Well, this is great. I mean, you've educated me on this a little bit, and now I understand a little bit more. And 20 times the amount of oxygen you would get. I mean, we love that. Our
Yeah.
mitochondria, it's like we're both mitochondrial geeks here, we
Yeah.
just love them. So, well, would you tell us a little bit more about your practice and the program that you have at your office in Sugarland?
Yeah, so I treat a lot of complex chronic illness, but
Okay.
just adults. I don't necessarily see kids. I'll see young adults sometimes late teens, but I started doing functional medicine because of the hormone, because of bioidentical hormones. And then,
Yes.
and then there's so many little avenues that you can go down with functional medicine, and that's part of why I think it's so fantastic because there's just always new stuff to learn. But, I started with hormones. I then started learning about gut health and detox. I then started, looking into mold and to Lyme. And I see quite a bit of mold patients too, I have to say. Much more. I do have some Lyme patients, but I feel like mold is much more prevalent here in Houston because we're just so
Yes.
humid and we're so flooded,
Yes.
you know,
Yeah.
flooding our
It's
humidity.
so true. Now,
Yeah.
as far as hormones go, when you talk about bioidentical hormones, what do you prefer and what are the different modalities that you use for hormones?
Yeah, so hormones, I always tell people the main thing is we don't want to take estrogen or testosterone in a pill form because that will lead to liver inflammation and a whole host of side effects that you just don't want to deal with.
Yeah.
So, you can basically do cream delivery where you put a cream on your skin, like external arm or leg. You can do a vaginal cream delivery. You can do pellet therapy, and pellets are compressed pieces of testosterone. They look like little grains of rice, and they get inserted in the flank area, down below the bikini line. And it's just a little 2 to 3 millimeter incision. And you put that in, and it takes me less than 5 minutes to do the pellet. The advantage of the pellet is that you put it in and it's doing its thing. You don't have to remember to put it on or, you don't have to stick yourself, all that good stuff. And you can accurately follow the blood or plasma levels to see where you are. Whereas the cream delivery, you're going to have to do a dried urine test to get an accurate picture of what's going on at the tissue level.
Okay.
So, you know,
So, in your practice, like what percentage of folks do you have doing pellets and is it male centric, female, what's the statistically, how's it
yeah.
divided?
Yeah, I would say I see men and women. I would say it's probably like 70% women, 30% men. I would say the majority of my patients are on pellets. I do have some that are on creams.
All right.
Yeah.
Here's a question I have. As far as the pellets go, a lot of times we'll see people. I have a family practice doc here in the clinic that works with me, and I do a little bit of bioidentical hormone therapy. I do topical because
Mhm.
that makes me feel good.
Yeah.
But we sometimes, and I guess it's probably the person who's taking care of them, we see a lot of women who lose their hair and they have these super physiologic dosages of the hormones
Yeah.
and they've got all these things going on. Can you speak into that and maybe
Yeah.
what might not be working with the pellets for them or
Yeah,
dosing?
absolutely. Yeah, you
Okay.
definitely have to be careful. Pellets, putting place pellets in people is especially women is very easy. But the dosing is it's more of an art form.
Okay.
It's tricky because you are pushing the testosterone to what we call super physiologic levels. Even if you're doing a low dose of pellet, it's still higher than what the quote average is, right?
Okay.
But that's what is bringing about, a lot of the benefits that you're getting, like, you're getting increased energy, you're getting easier to build muscle mass, your bones are stronger, you're sleeping better, it's causing a lot of anti-inflammatory effects. So these are all the benefits of having higher testosterone. Now, when testosterone gets broken down in the body, it can go down one of two pathways. It's either the alpha or the beta. And genetically, you're going to favor one over the other. And so, if you're favoring more of the alpha pathway, you're going to produce something called dihydrotestosterone or DHT. And this can be responsible for scalp hair loss, facial hair, acne, and in men, prostate enlargement. So it's definitely something that I keep an eye on. And if it looks like somebody is favoring that alpha pathway, I'm gonna put them on something like, sal palmetto and stinging nettles, which will push it
Alright.
towards the beta pathway. So
Okay,
it's
okay.
definitely something, but, I always tell people hair loss is such a multifactorial thing, and people
Yes.
love to blame well, it's obviously the pellet because that is but that's what the only thing that has changed. However, there's a lot of different factors that go into hair and, number 1 is just genetics. We have these DHT receptors all over our scalp in a specific genetic pattern, and
Ah,
sometimes just that little bit extra DHT, that boost of testosterone is enough to sort of start activating those.
oh,
And then they start, once the DHT receptors are activated, they start causing that miniaturization of the hair follicle. But
okay.
other things too, like, a lot of people now are on these GLP-1
I know.
medications that cause them to lose their appetite. They stop eating to lose weight, and so they're having this dramatic weight loss, and then 3 months later, the hair starts falling out. And
Yes,
so, that can be a huge thing too. Or if they were ill, if they got sick, and then again, it's never an immediate thing, it's like 3 months later because the hair is
correct.
just very slow growing.
I'm
So,
so glad to hear that. I mean, it's the same thing we tell folks, and then too, you have this thing with kids, telogen effluvium, where they'll go through these cycles of losing their hair, but, like you said, so multifactorial.
yeah.
Wow.
Yeah,
So
absolutely.
Julia, at your clinic, and I guess we started on one thing, and then I wanted to learn a little bit more. So you have a staged approach. So when someone comes in, what is the system that you have in place? I was looking at your website, and it's a program. So it appears.
So I'm actually in the process of revamping my website just to kind of
Okay.
reflect my, because my practice, I mean, I'm ever changing, ever evolving because as I learn new things, I want to put those into practice. And so what I'm doing now is if somebody wants to see me, we set up a discovery call with myself. And it's just like a 15-minute phone call and we talk about, what's been going on with them, what their goals are, and if it seems like it would be appropriate for us to work together. And if it is, then they move forward with our functional health assessment. And that's where we have them come in. We do a huge panel of blood work that looks at really detailed hormone panel, thyroid panel. We do an expanded lipid profile panel in addition to the standard metabolic stuff as well. And then we have two scans in the office that we do at the same time. One's just a bioimpedance scale that measures muscle, fat, and water where everything is located. The other one is called the glycocheck, and that is a scan that looks at the health of your tiny capillaries. So it's a non-invasive, it's just like this high-powered video microscope that on end of a stick, and it just goes under your tongue because you can actually see the vessels under your tongue without having to cut you open. And so it's
Nice.
pretty amazing what this technology can do because it's looking at how many of these tiny capillaries are actually functioning in a, little square area under the tongue, and it's also measuring something called the glycocalyx. The glycocalyx is like this thin gel-like matrix that lines all of our blood vessels. Whether it's a tiny capillary or a big vessel, the glycocalyx is there and it's held in place by these tiny little hair-like kind of projections. And the purpose of the glycocalyx is to hold the fluid in the vessel. It helps to protect the wall from damage, and then it houses all the natural antioxidant defense mechanisms like nitric oxide, superoxide dismutase, all that kind of stuff. So when the glycocalyx gets rubbed off or destroyed because of aging, genetics, poor lifestyle choices, high sugar, high stress, then we start losing those tiny capillaries. They cannot function without their glycocalyx lining. And so then you get
Ah,
less peripheral vascular blood flow. And so, so for example, somebody who's, say, morbidly obese, they have 50% less peripheral vascular or tiny capillaries than somebody who's not. So,
okay.
now there is a supplement we have that will help give your body the building blocks it needs to regrow this. So once we measure what your microvascular health score is, we can do something about it. And it's not just like,
Yes.
sorry.
Yeah,
Yeah.
yeah, yeah, we used to think the skin was the largest organ, but the glycocalyx is the largest, isn't it? The
Yeah.
lining of all of our
Yeah.
body. How long has this glycocheck been around?
So we were one of the first clinics to get it because it's been in the research hospitals for the last, like, 15, 20 years. And if you go to their website, they have a whole page on all the research that has been done with this. It's pretty fascinating. Because
Nice.
if you take this supplement that regrows your glycocalyx, you can actually do things like normalize blood pressure. You can improve kidney function. You can help improve brain fog because you're getting more blood supply to those organs, you
It's
know?
amazing.
Yeah, yeah.
It's incredible. So after this evaluation, the blood panel, the glycocalyx, the bioimpedance assessment,
Yeah, yeah.
then
Then they
then
come
where
back.
did
Yeah, and
okay,
and there's an online health questionnaire, of course, that's pretty extensive. And so then they
okay.
come back and we go over all the results, and I kinda give them a bird's eye view of, like, where your health is and where I would recommend moving forward.
Okay, okay.
Yeah.
If you were thinking back over the majority of your patients, which are mostly grown-ups, I will
Mhm.
say, where the majority of the time, where do you end up starting?
So lately, I've been starting with I do kind of 2 things at once. I talk to them about nervous system regulation, and then gut health is a pretty big second one because a lot of people, and especially if they're having any kind of emotional issues, mental health kind of issues, you have to address gut health. But also at the same time, that nervous system regulation is so key and important because if your nervous system is dysregulated, if you're stuck in that fight, flight, or freeze mode, it affects your hormones, your immune system, your gut. It's just like it's a top down kind of a thing. And so we
Yes.
really need to address that. And I think in the past, when I was just focused on hormones and even detox and gut health, there was always a certain percentage of my patients that just didn't respond. They didn't feel the benefits of the pellets or they didn't feel the benefits of the gut health that we were trying to do. And it was because their nervous system was so dysregulated.
As you speak about that, we think about, the functional medicine matrix. I know that A4M is a little different, IFM is a little different, but at the core of all of us, if we don't deal with our emotional, mental, spiritual
Yeah.
trauma and all of that. So are there any programs that you're using, any specific programs? I mean, we talk about breathing, sometimes we talk about the Gupta program, but do you have
Yeah.
something proprietary in your clinic?
I refer a lot of people to primal trust.
Ah,
I'm not
yes.
not sure if you're familiar with that, but I love the primal trust because it has a lot of vagal nerve toning as well as the amygdala retraining. It just that works really well. Occasionally, I'll run into patients who are so sick or who are so dysregulated they can't even tolerate primal trust, and then I'll refer them to a company called brainharmony.com. And
Okay.
Brain Harmony has listening programs, meaning that they have these special headphones and, special music that you listen to. And what it's doing is building up the muscles of the inner ear, which help convey signals of safety to the brain. So they have those listening programs and they have something called Alpha Stim, which is a little tiny electrical device that you put little clips on your earlobes and it starts generating alpha waves in the brain, which are very relaxing.
Nice.
But they layer in a very so they have you fill out an online survey, I think about 30 questions, and then you get to talk with the owner of the company, and they design a program appropriate for you. Because again, it's a very, kind of passive program to do. You don't have to there's not a lot of it's completely different from, like, like Annie Hopper's DNRS program, the Gupta Primal Trust, the
Yeah.
I'm a strong believer that you just kinda have to find the program that resonates with you, because
Yes.
everybody's different.
Julia, thanks for unpacking the approach that you use at your office. I'm going to ask you kind of an odd question, but not really.
Okay.
If reflecting back as a mom of 5 kids,
Mhm.
what would you tell moms now, like, what would you have told your younger self after having lived through some things? I know I
Yeah.
was a totally different mom to my last 2 kids than I was to my
Yeah.
first 2 kids.
Yeah. Ooh, I would say if I was speaking to my younger self, I would say, be kinder to yourself. I think we're always so hard on ourselves. And when you're in the midst of raising kids and you're going 10 different directions at once, and it's just like, it just, it's so hard to take time for yourself. And we get in this stress, fight or flight mode. And then we start normalizing that stress. And so pretty soon you don't even think you're stressed, but you're very much stressed. You know what I mean?
Yes.
And so I think that's really hard on the body. When I first did my first glycocheck test with the probe under the tongue, my microvascular health score was less than 1. And
Oh,
so the score goes from 0 to 10 or more, and you can get up into the 30s, 40s, but, so I'm like, "Why is my score so low?" I think it's been the chronic cortisol that I've had
yes.
'cause I exercise, I don't eat a lot of bad foods, but, it's that chronic stress that's just, and up until recently, now this past year or so, I've been doing a better job of making time for meditation, for relaxation kind of stuff. But before that, I didn't do anything. And it was just like go, go, go all the time. There was just extreme stress. And yeah, so that's what I would tell my younger self is like, be nicer to yourself, take some time for yourself, whatever you can do.
I appreciate that too. I have a little sticker on my laptop that my daughters gave me. I have 4 daughters. They're like 19 to 31, but it says, "Be kind to yourself."
Yeah. Yeah.
So same thing. So I'm really glad to hear that reiterated. And I don't think there's anything worse than mom guilt.
Yes. Yes.
And when we look back and we go, I can't believe I did that. I can't believe I went through the drive-through twice a day and it was crap, but I was feeding my kids. And yeah, no wonder I was 300 pounds or whatever in
Yeah.
the past,
Yeah.
so all right. So I am so glad to have been educated about hyperbaric oxygen and to learn about your approach. What's the major how many patients would you say you've got on topical versus the pellets? Are the majority of your patients on pellets?
I would say maybe 10% are on creams
Okay.
versus the majority on pellets. Maybe it's 80-20. I don't know. It's somewhere.
Yeah.
Yeah,
Yeah.
it's not. It's definitely the majority are on pellets. But
Okay.
that's, my experience when I started bioidentical hormones, and the first thing I did was put myself on some creams. And
Mhm.
and with the creams or the pellet, you're taking, progesterone as a capsule. The advantage
Right.
of taking oral progesterone is that when it breaks down in the stomach, it mimics GABA, which is a very calming, relaxing neurotransmitter, so it adds to a good night's sleep. So, both ways you're doing oral progesterone, but when I started the creams, I couldn't tell the difference when I was on or off. But
Mm.
now granted, I did have a problem remembering to put it on, but even when I was consistent, I was like, I don't feel much different." But when I got the pellet for the first time, that was a game changer. All of a sudden,
Okay.
I remember driving home one afternoon going, "Wow, I don't feel, like, excessively sleepy," I'm not
Yeah.
just fantasizing about when my next nap is gonna be. So,
Yeah.
it was for me, it was a total game changer. Yeah,
Excellent. Are
yeah.
you using any peptides in your practice?
Yes, yes, I do. I use a lot of the Wolverine peptide, the BPC 157 with thymosin beta 500.
Yes.
I've used, like, things like C-Link, thymosin alpha 1, CJC with ipamorelin. Yeah, so a variety of things, and of course the GLP-1s, we'll use those
Yeah.
judiciously as well.
Are you using ultra small dosages of the GLP-1s?
Yes, yes.
Okay, okay.
And especially for some of my patients who are chronically inflamed,
Yes,
it does bring about some anti-inflammatory, but you have to, really microdose it is fine. You don't have to do the big doses.
correct, correct,
Yeah,
yeah.
yeah,
Ah, well, Julia, thank you so much, and the education that you provided about hyperbaric oxygen and your approach dealing mostly with grown-up patients
yeah.
versus a lot of the pediatric stuff that we do over here at Hope for Healing. I am so appreciative of your time.
Thank you
We're
so
gonna
much. It's been a real
Yes.
pleasure.
Yeah, thanks for being our guest. All right. So again, here at Hope for Healing, we thank Bagran, our genomic sponsor, because we can identify vulnerabilities. And in what Dr. Ward brought up today about nitric oxide production and deficiencies in the body, that can be identified early on. And so you can start supporting that. All right. Well,
So
thank you so much.
Thanks for joining us at Get to the Root with Hope for Healing. If this episode helped you, follow and share it with someone who needs it, and leave a review. It helps others find us too. For a free consultation, visit our website at gettotheroot.com with the number 2 and schedule a welcome call. We'll see you soon.